Hello, ladies and gentlemen. So I'm going to address some myths, kind of just winging this in plastic surgery. I've heard quite a few of them over the years. I'm just going to address them one at a time. I've heard from my patients they think early Botox when they're teenagers or 20-year-olds is a good idea to help prevent aging. I don't think that really works. You really don't need Botox until you start getting enough motion and signs of aging, typically 30s to 40s. Fillers are okay. They kind of overpromise and underperform. I'm very conservative about filler use. I think it gets oversold in the marketplace. It makes putting a lot of filler in. Sometimes I have to actually get it dissolved before I can operate. It can make my surgical planes less easy to develop. It certainly does hurt the lower lid area. I'm not a fan of this. Skin's too thin. So I would avoid doing the lower lid personally if I were you. Speaking of fillers, I don't like the liquid rhinoplasty that people talk about. There's too many vessels that are attached to the dermis here, and they can get occluded from the filler, and you can end up with ischemic skin, which can be hard to fix, or sometimes it can leave scarring. Just not worth it. I think it's too risky. Non-surgical skin tighteners, a lot of not necessarily lasers, but ultrasound, radio frequency devices, things of that nature. Again, I would say overpromise, underperform. The fact of the matter being that sometimes it can actually make it more difficult for me to do any sort of work later on because of scarring from the treatments. And I worry about late onset of fat atrophy, especially from the radio frequency devices. Fat is what keeps us looking decent, the subcutaneous fat. And if you use heat to try to tighten the SMAS, you can, technically speaking, theoretically speaking, practically speaking, there probably will be some fat atrophy, and that's not a good thing. So you have to be wary of those treatments. When to do surgery, early versus late, there really isn't any standard right answer there. Best time to do surgery is when it bothers you enough that you're willing to pay me to fix it. That's really the best answer I have for that. And that can be different ages for different folks, different ages for rhinoplasty versus other things. Most common thing I do in youngsters, teens and 20s, is their nose. For aging, the most common thing I do early on, 30s to 40s maybe, mainly 40s, is the brows and the lower lid. So there's no right answer there. Like I said before, when it bothers you enough that you're willing to pay me to fix that. Skincare products, I don't sell them anymore. I think they're fine. I refer people to dermatologists for that. Certainly there's some good evidence that they help a bit in the aging of the skin, the skin quality, but they're certainly not going to tighten the skin. So don't get wrong impression that they're going to prevent you from aging. They're going to help your skin quality, the appearance of your skin. That's about it. I'm not a big fan of the Fraxel laser. I think that also overpromises, underperforms. Don't think it's worth the money that people charge. The other myth out there is this new ultrasonic rhinoplasty, where this ultrasonic little thing that cuts your nasal bones are going to make your surgeon better. No, that's not true. A good rhinoplasty surgeon is somebody who's got gray hair, specializes in facial aesthetics, has been doing it for many, many years, and who has lots of good pictures on their website. How they do their cuts here is immaterial. Now, the only minor benefit from the ultrasonic might be that you have less bleeding, but that's a might. There's a downside. You have to lift the skin envelope up a lot more than you do when I do osteotomies. And if you have very sharp osteotomies, which mine are on a what we call a hit count. So after they've been used a certain number of times, they get sharpened. So they're always sharp. That's very atraumatic. And I do a subperiosteal tunnel, so I get very little bleeding from that actual part of the procedure if they need it. So don't get sold on a product that's going to do your nose. Like if he's got an ultrasonic thing, he knows how to do rhinoplasties. That's just not the case. Be careful of that one too. Healing always takes 6 months to a year for almost everything I do, especially rhinoplasty, but most people look pretty good from rhinoplasty in 2 weeks. They just have swelling left. From facial aesthetic surgery, most people can go out and about in about 2 weeks, but certainly they wouldn't want to schedule any major social events for 6 weeks to 2 months on average. Even at 2 weeks, they may have some minor residuals, bruising they have to hide, and certainly they will notice they still have some swelling, but most other people will not notice that. Men in cosmetic surgery, yeah, I do quite a few men. Most of the men I do, it's not quite the same as the average lady that I see, but men do come in. A lot of men that are tired of looking old and grumpy. It's usually their forehead that's just kind of pushed down and made them look old and grumpy. Do a lot of lower lid surgery in men. I'll do an occasional lift in a man, especially one that's out on the market again, so to speak. That's not uncommon. So yeah, we see men, but it's still probably about 80-20 balance between women and men. So that's kind of the common things that I thought you might find interesting. Myths that you might find nice to clear up, and you have a good day.